All right, getting started just in a second, letting the audience build up a little bit. All right, good evening, everybody. This is Dr. Barnes. I got some cool new technology for you here. Some better lighting. I feel like I look like a movie star here with this on, so this is exciting. But here's what I want to do. So I have 3 recent research studies from medical journals that are talking about why statin medications, which is the scientific term for high cholesterol lowering medications, are not only really a scam and a lie, but actually they're harming and destroying your body tremendously, okay? So I will put out a disclaimer is that I'm not a medical doctor, so this is a result of medical research that I'm seeing here as well as my opinion, okay? So first one, all right? This is out of the journal of, actually it's out of Penn State College of Medicine. And what they did is they looked at 20,000 Parkinson's patients and they found that statin use, okay, so taking a high cholesterol lowering medication led to a dramatically increased risk of Parkinson's disease. So again, what they found is that through this article and through this journal is that previously they found that if you have high cholesterol, okay, that actually has a protective effect for diseases like Parkinson's and other brain disorders like Alzheimer's. So the reason being is that 60% of your brain is actually made up of cholesterol and fat. So when a statin medication goes in your bloodstream, it doesn't differentiate and it can't selectively target just the cholesterol that might be floating around in your bloodstream, but it's going to attack and kill any and all cholesterol, including what's in the brain. Which, you think about it, if you're lowering the cholesterol and destroying the brain matter, well then of course your risk of having Parkinson's or memory disorders or other brain disorders is going to be going through the roof. So again, they found in their literature that if you have high cholesterol, there are beneficial outcomes in Parkinson's disease, and that the statins take away that protective effect by treating the high cholesterol. So the other thing they found is that it also might block coenzyme Q10, which is essential for cell function, which is what statin medications do. So again, it's not a small study. This is looking at 20,000 people that had Parkinson's disease and found out that the majority of them have been on a statin medication for at least 6 years or more. Here's another one. Statin medications, again, high cholesterol lowering medications, increase the risk of diabetes by up to 50% in older women. So statin therapy, and this is out of a study in Australia where they looked at a total of almost 9,000 Australian women, okay? They found that if you take a statin medication, on average, it will increase your risk of diabetes by 33%. And the reason why is it raises blood glucose because it impairs your body, it destroys your body's ability to handle blood glucose, so carbohydrates and sugars coming into your bloodstream. And then when that stays elevated, then your pancreas is working, and over time it's going to be destroying your body's ability to handle that blood sugar, leading to an increased risk of diabetes. So they found that in some cases it led to up to a 51% increase in diabetes for women. So again, when a person gets put on a statin medication, this is not something that they are likely told, the actual risks factors of this, but they're really just, again, treating the symptoms and leading to other problems. And another one, and as a chiropractor, this of course is very interesting in that when they looked at a major military base in Texas, they actually looked at over 60,000 individuals who were at least 30 years old, and they found that if these people took a statin medication, that there was a chance of having a back disorder increased by between 30 to 47%. And those were things like spondylosis, which is, is basically arthritis, intervertebral disc disorders like disc herniations, disc bulges, and even other conditions like spinal stenosis, which a lot of those conditions, when they're not treated properly, in fact, if you go to your medical doctor and you have any of those conditions, the chances of you being referred to an orthopedist is extremely high, and the chances of you being referred eventually to an orthopedic surgeon is extremely high. So we're looking at a slippery slope into having a back surgery, which is of course permanent, can be disabling sometimes, and of course costs a lot of money as well. So again, over 30 years old, when they were taking a statin medication, found that they increased their risk of having a disorder in that category, basically arthritis, spondylosis, disc problems, or spinal stenosis, which is a narrowing of the central canal of your spinal cord, which pretty much always leads to surgery or at least debilitating problems, increased by 30 to 47%. So why do I talk about this? Is that when you have a condition like high cholesterol, the difference in the question of what the medical system asks, they ask, how do we treat that symptom? Because in their research, which is typically skewed by the pharmaceutical companies, or one could say it's always skewed by the pharmaceutical companies' research, is that they're gonna say, okay, well, if we get this many people on medications, we're gonna make this much money, so let's manipulate the data. And there's been lots of books written on it. It's a big problem. So I'll let you look up. I'm not going to talk too much about that now. But the difference between figuring out, okay, what is wrong with this person? Why is the body doing this? How do we treat this symptom? From a chiropractic standpoint and from a natural standpoint, what we're really looking for is what is the cause. Okay. Now, and in many cases, pretty much almost all cases, actually, the symptom of the body is the body doing the right thing at the right time for the right reason. So cholesterol has many protective benefits. It's actually the body's response to inflammation as a primary cause, especially in the cardiovascular system. So if you have extremely high cholesterol, well, one thing you have to look for is, do I have lots of inflammation in my body? Am I eating foods that are causing lots of inflammation, like grains and sugars and bad fats? And do I have toxins going into my body as well? So the reality is this. If I could sum it up with this, is that if you're sitting in your medical doctor's office and they find something wrong with you, and then you walk out of that office with a prescription, I would invite you and encourage you and really implore you to not just march mindlessly to the pharmacy and fill that prescription. Instead, what you need to do is you need to ask the question, why? What is going on with my body right now? Why do I have this symptom? Am I doing what I'm supposed to? And what is the answer? Because if you can figure out the why of the problem, well, then you can figure out what the result is, right? The symptom is part of the cure. And the reality is this, is that 80% of the cholesterol inside of your bloodstream right now is actually made by your body. 80%. So knowing that, then if you believe that God created your body, well, then he wouldn't make your body to self-destruct itself, okay? Meaning that he wouldn't just make your liver produce this waxy substance, this fatty substance that is going to be destined to kill every single person. Basically, that's alive, okay? God didn't give American bad hearts. God didn't give American bad cholesterol levels. It's what we're doing to ourselves that is causing the problem. So my friends, my patients, or if you're just in our community or watching this from all across the world, the thing I want you to walk away from is that the drug is not the answer. It may save lives in crises sometimes, but really medications are just a prescription for continuing to live a bad lifestyle. It's a permission slip to continue to live a poor lifestyle, and that's just not a good way of living. So stay tuned for more videos like this. Please go ahead and like and share this if you're watching this right now. Leave a comment in the comment section, or if you have any questions, I'll absolutely come back and answer each and every single one of them that I possibly can. But those likes and shares really go a long way for helping people hear the truth. So until then, peace out. Dr. B signing off.